As men, we often experience changes in our urinary habits as we get older, perhaps more frequent trips to the bathroom, a weaker stream, or needing to get up more often at night. While these can be common signs of an enlarged prostate, have you ever considered if they could be linked to something more serious, like prostate cancer? Prostate cancer is one of the most common cancers among older men, yet it often grows slowly and can be highly treatable, especially when caught early. Understanding your personal risk factors and the options for prostate cancer screening and treatment is crucial for your long-term health and peace of mind. It's easy to dismiss subtle changes, or perhaps you feel a discomfort or even fear about discussing prostate health or undergoing screening. However, ignoring potential symptoms or delaying recommended screening can mean missing the opportunity to detect cancer at its earliest, most treatable stages. When prostate cancer is found late, treatment options become more limited and the disease is much harder to control. You might think it's too much information or a private matter, but being informed and proactive can truly be life-saving. In this video, I'm going to share 3 crucial insights about prostate cancer in older men, the key risk factors and symptoms to watch for, the importance and considerations of screening, and most importantly, how modern treatment options offer personalized choices for a better quality of life. You'll learn simple ways to discuss this with your doctor and make informed decisions about your prostate health. Before we dive into these vital insights, if you're committed to understanding men's health and making informed choices, please hit that like button right now. It truly helps us share this crucial information with more men who need it. And don't forget to subscribe to our channel and ring the notification bell so you don't miss our next helpful health tips designed just for you. Finally, let us know in the comments, prostate health, if you're ready to take charge of your well-being today. All right, let's start by understanding who is most at risk and what signs to watch for. Identifying key risk factors and subtle warning signs. The first crucial insight is to understand your personal risk factors for prostate cancer and to recognize the early symptoms that might indicate a problem. While many cases are found before symptoms appear, paying attention to your body is always vital. The prostate is a small gland located below the bladder in men, surrounding the urethra, the tube that carries urine out of the body. Its primary function is to produce fluid that nourishes and transports sperm. Prostate cancer typically develops slowly over many years. Key risk factors include: this is the most significant risk factor. The risk of prostate cancer increases sharply after age 50, with most cases diagnosed in men over 65. If you have a father or brother who had prostate cancer, especially if they were diagnosed before age 65, your risk significantly increases. African American men have a higher risk of developing prostate cancer and are more likely to develop aggressive forms of the disease at an earlier age. Early prostate cancer often has no symptoms at all, which is why screening is important. However, as the tumor grows, it can cause symptoms, often related to urinary function due to the prostate's location. These might include frequent urination, especially at night, weak or interrupted urine flow, difficulty starting or stopping urination, painful urination or ejaculation, blood in the urine or semen less common, but serious, new onset erectile dysfunction. In advanced stages, prostate cancer can spread, leading to symptoms like persistent pain in the hips, back, or pelvis. It's important to remember that many of these urinary symptoms are also common with benign prostatic hyperplasia BPH, a non-cancerous enlargement of the prostate, but they should always be evaluated by a doctor. My friend Frank, a robust 70-year-old, had been experiencing a weaker urine stream and getting up 3 to 4 times a night to use the bathroom for several years. He brushed it off, saying, "It's just my prostate getting bigger. My dad had it too." He avoided discussing it with his doctor due to discomfort. It wasn't until he started having persistent pain in his lower back that he finally went for a checkup. Sadly, tests revealed he had advanced prostate cancer that had spread to his bones. "I deeply regret not getting it checked sooner," Frank confided in me. "I thought it was just BP." If I had known those subtle changes could be something more, I would have faced my fears and seen the doctor years ago. Early diagnosis could have meant so many more options. Frank's experience is a powerful reminder not to ignore symptoms, even if they seem minor. For you, recognizing your risk factors and being aware of these potential symptoms is the first step toward proactive health management. It means you can identify potential concerns early, which is crucial for better outcomes if cancer is present. Be aware of your family history and discuss it with your doctor. If you experience any new or worsening urinary symptoms or unexplained pain in your back or hips, report them to your doctor promptly. If you're now more aware of prostate cancer risks, let us know by commenting risk aware below. Recognizing symptoms is important, but because early prostate cancer often has no symptoms, screening becomes a critical part of early detection. The second crucial insight is understanding the role of prostate cancer screening, primarily through the PSA prostate-specific antigen blood test and the digital rectal exam DRE. These are the tools used to detect potential prostate cancer early, but they come with important considerations. This is a simple blood test that measures the level of prostate-specific antigen, a protein produced by prostate cells. Elevated PSA levels can indicate prostate cancer, but they can also be raised by other conditions like BP, prostate infection, or even recent ejaculation. This means a high PSA doesn't automatically mean cancer, and a normal PSA doesn't always mean no cancer. During a DRE, your doctor inserts a gloved, lubricated finger into the rectum to feel the prostate gland for any lumps, hard spots, or abnormalities. While it might be a bit uncomfortable, it's quick and provides valuable information about the prostate's physical characteristics. The decision to undergo screening is a personal one that should be made in shared decision-making with your doctor. Here's why. It can detect potentially aggressive cancers at an early stage, when they are most treatable and curable. This can lead to life-saving interventions. The PSA test can have false positives, a high PSA that isn't cancer, leading to unnecessary anxiety, and further tests like biopsies that carry risks. It can also lead to overdiagnosis, detecting very slow-growing cancers that might never have caused problems in a man's lifetime, leading to overtreatment with potential side effects like erectile dysfunction or urinary incontinence. Your doctor will consider your age, overall health, life expectancy, family history, and preferences when discussing if and when to begin or continue screening. For most men, discussions about screening typically begin around age 50 to 55, or earlier around 40 to 45 for those with higher risk factors. My friend John, a vigilant 65-year-old, initially resisted routine PSA screening because he'd heard about the potential for false positives and unnecessary biopsies. However, after his brother was diagnosed with aggressive prostate cancer at age 62, John decided to discuss it with his doctor. His doctor explained the nuances of the PSA test and DRE, emphasizing that it was a starting point for discussion, not an immediate diagnosis. John decided to get screened annually. 1 year, his PSA came back slightly elevated. His doctor monitored it, and when it continued to rise, a biopsy confirmed a small, early stage, but aggressive prostate cancer. That PSA test saved my life, John stated firmly. My doctor and I had talked it through, so I understood the process. Because we caught it so early, my treatment options were excellent, and I'm now cancer-free. John's experience highlights the power of informed screening decisions. For you, understanding the pros and cons of screening empowers you to have an open, informed conversation with your doctor. This shared decision-making process ensures that screening aligns with your personal health goals and values, offering the best chance for early detection if needed. Have an open and honest conversation with your doctor about prostate cancer screening. Discuss your age, family history, race, and overall health to determine if and when screening is right for you. Don't be afraid to ask questions about the PSA test and DRE. If you're discussing screening with your doctor, type screening talk in the comments. If prostate cancer is diagnosed, the next critical step is understanding the array of treatment options available, which are highly personalized. Understanding your choices for managing prostate cancer. The third crucial insight, especially if a prostate cancer diagnosis is made, is to understand that there are a variety of treatment options, and the best choice is always a highly personalized one based on many factors. Once prostate cancer is diagnosed, a multidisciplinary team, including a urologist, radiation oncologist, and medical oncologist, will work with you to determine the most appropriate course of action. Treatment decisions are carefully weighed based on how far the cancer has spread and how quickly it's likely to grow, often indicated by the Gleason score from a biopsy. Your life expectancy and ability to tolerate potential side effects of treatment. Your concerns about potential side effects like urinary issues, erectile dysfunction, or bowel problems. For very low-risk cancers, where the cancer is slow growing and unlikely to cause harm, doctors may recommend regular monitoring PSA tests, DREs, biopsies instead of immediate treatment. This avoids side effects of treatment while still keeping an eye on the cancer. Removal of the entire prostate gland and sometimes nearby lymph nodes. Effective for localized cancer, but carries risks of urinary incontinence and erectile dysfunction. Uses high-energy rays to kill cancer cells. Can be external beam radiation from outside the body or brachytherapy, placing radioactive seeds directly in the prostate. Side effects can include urinary, bowel, and erectile issues. Reduces male hormones androgens that fuel prostate cancer growth. Used for more advanced or recurring cancer, but can have side effects like hot flashes, fatigue, and decreased libido. Used for advanced cancers that have spread or are no longer responding to hormone therapy. The key is shared decision-making, you and your medical team discussing all options, their potential benefits, and their specific side effects to choose the path that best aligns with your goals and quality of life. My acquaintance Robert, a healthy 76-year-old, was diagnosed with a very low-risk prostate cancer. After extensive discussions with his urologist, he chose active surveillance. I decided to keep an eye on it, Robert explained, because the doctor felt the side effects of immediate surgery or radiation might outweigh the benefit, given how slow-growing my cancer was. I get regular PSA tests and checkups, and I feel good about my decision to maintain my quality of life. In contrast, David, a 68-year-old, was diagnosed with a more aggressive, but still localized prostate cancer. After getting a second opinion and weighing his options, David chose radical prostatectomy. I wanted the cancer out, David said. I understood the risks, but my priority was to be cancer-free. I worked with my medical team on recovery, and I'm glad I made that choice for my situation. These stories illustrate that there's no single right treatment. It's about what's right for you. For you, understanding these diverse treatment options empowers you to actively participate in your care. Imagine making an informed decision that balances cancer control with your desired quality of life, leading to greater peace of mind and satisfaction with your treatment path. Especially for localized prostate cancer, consider getting a second opinion from another urologist or radiation oncologist. Don't hesitate to ask your doctor about active surveillance, surgery, radiation, and hormone therapy, and their specific side effects. Be clear with your medical team about what's most important to you, preserving urinary function, erectile function, or simply maximizing cancer control. If you're ready to explore all your options, type informed choice in the comments. Now that you understand the risks, screening, and treatment options, let's delve deeper into general advice for managing prostate health and common pitfalls to avoid. While no specific diet guarantees prostate cancer prevention, a balanced diet rich in fruits, vegetables, and whole grains, low in red and processed meats, and regular physical activity can contribute to overall prostate health and general well-being. This is key. Don't be shy or embarrassed to discuss urinary changes, sexual health concerns, or family history with your primary care doctor or urologist. Follow reputable sources for prostate cancer information, e.g., American Cancer Society, Prostate Cancer Foundation. If you receive a diagnosis, consider joining a support group for men with prostate cancer. Sharing experiences and advice can be invaluable. If a loved one is going through diagnosis or treatment, remember to also seek support for caregivers from the same organizations. As discussed, even subtle changes warrant a conversation with your doctor. While concerns are valid, discuss them openly with your doctor. Early detection often means more choices and better outcomes. Take your time, gather information, and get second opinions before deciding on a treatment path. The goal is not just to treat the cancer, but to maintain the best possible quality of life afterward. Factor potential side effects into your decision making. This is a crucial risk factor that your doctor needs to know. For any prostate health concerns, your primary doctor can be a starting point, but a urologist is the specialist who will provide definitive diagnosis and discuss treatment options. If cancer is diagnosed, you will often work with a multidisciplinary team including a urologist, radiation oncologist, and medical oncologist. They will help you navigate complex decisions through a shared decision-making process, ensuring your treatment plan is tailored to you. So, as we've explored understanding prostate cancer, your risk factors, the importance of screening, and the personalized treatment options is one of the most powerful steps you can take to safeguard your health and quality of life in your golden years. We've seen how recognizing subtle symptoms and understanding your genetic risk can be crucial, how informed screening decisions empower you, and crucially, how personalized treatment choices lead to the best possible outcomes. The beauty of gaining this knowledge is the control it gives you over your own well-being. I understand that thinking about cancer can be daunting and evoke fear. It's natural to want to avoid unpleasant truths or dismiss discomfort. But ignoring these vital facts means risking a misdiagnosis, potentially leading to more advanced disease, with fewer treatment options and a greater impact on your quality of life. Don't let hesitation or misunderstanding prevent you from getting the necessary care and information. The wonderful news is that prostate cancer, especially when caught early, is often highly treatable. It is never too late to learn, to talk to your doctor, and to make proactive decisions about your prostate health. You have the right to clarity, to comprehensive care, and to a life free from preventable suffering. You have the power to make that choice, starting today. As you've discovered, understanding prostate cancer in older men isn't just about statistics. It's about recognizing your unique risks, knowing when to act, and empowering yourself with knowledge to make informed decisions about your health. It's about safeguarding your vitality, preserving your independence, and enjoying a fulfilling life. After watching this video, what's one key piece of information about prostate cancer that you'll remember most? Or what step will you take today to discuss your prostate health with your doctor? Share your thoughts and experiences in the comments below. We'd love to hear from you and build a supportive community. If you found this video helpful and valuable, please take a moment to like it. Your support truly helps us continue to create content that genuinely empowers our community. And if you haven't already, subscribe to our channel and hit that notification bell so you'll be the first to know when we release new crucial health insights. Most importantly, if you know someone, a friend, a family member, or a neighbor who might benefit from understanding prostate cancer risk, screening, or treatment options, please share this video with them. This information could be the spark they need to get tested, take action, and potentially save a life. Wishing you and your loved ones continued prostate health, peace of mind, and abundant happiness. Remember, your health is in your hands. See you in the next video.